just to say, and I think here is where I mentioned about sampling. The whole point is that we can't look at everybody in the population. If we wanted to look at all pregnant women in a particular country, that would be impossible because we wouldn't really know about every single case within every single person within that population who was pregnant. So we might want to know something about the prevalence of mental health conditions during pregnancy, but we can't measure that disease in the whole population. And so that is the question about how to measure the prevalence of disease in the whole population. Well, the answer then is to take a sample, and the most important represent a sample that's going to represent pregnant women in the population, or represent university graduates within this population, or represent some other type of people within that population. And so taking a representative sample is a whole area of expertise in itself. And again, you can have a whole lecture on that. I'm not really going to go into that, just to say that epidemiological research is about taking a sample from the population and then measuring our outcome within that sample. The important thing about the representative sample is that if it's properly constructed, we can then use that sample to say something about the population. And that's really statistical inference. We use that sample to say something about the population. We measure the disease in the sample and say that because it represents the population, that will be a useful measure of the prevalence of disease or the incidence of disease within the population. Okay, there's a question here somewhere. Yeah, someone's got their hand up. Who's that? No, I can't see it. Okay, yes. Saina Boy, do you want to ask your question? I think you can unmute.
Thank you, Tom. This is a really essential part of this training, and
all right.
Yes, I'm kind of a newbie in mental health research, even though I've been in the field of research for quite a while now. So I was just wondering, because there is this pre-award project that I am trying to put together. So I was just wondering, is it, because we were trying to do like a situational analysis of the mental health conditions or issues in the Gambia, not conditions, but issues in the Gambia. The Gambia is in West Africa. You know, it's where MRCG is situated. Yeah. So my question actually is, in terms of the sampling, if we are trying to do also a prevalence component of that project, do we have to still do like a sampling calculation, or should we look at every single region within the Gambia and do a sampling population from it?
Okay, so that's a sort of question about sampling, which I wasn't really going to cover too much in, but of course, it's quite difficult to cover every single region in a country, even if the country is quite small like the Gambia. And you may select a number of regions to do that. And then you would select, this is called a cluster sample, in which case you would select your clusters to begin with, and then you would select a number of people within each cluster to take your measurements from. And your measurements might be on, the prevalence of, it might be on a particular condition, let's say depression or anxiety, but it might also be about awareness of mental health conditions amongst health workers. You would be sampling from your health workers there. So there would be an element there that you would be sampling a certain number of regions from in the country, or districts, or villages, or wards, or health facilities, or whatever it is that you're looking at there. And then you might then sample 10 or 20 different people from each of those, or 100, or many, it depends on your sample size, how many people you want to choose from each of those clusters that you've chosen within the country. So cluster sampling is a very common way of collecting samples from your population. Yes. Okay.
Thank you for that answer. And I also was just wondering one more thing. Are you open to someone reaching out for you in terms of support in fine-tuning their research idea?
Sure. I think the whole team here, I think within APHE, there's a sort of team of about 5 or 6 of us, as well as, you know, a number of people who are giving the lectures. And I think all of those, Sylvia, Joel, Muluse, and others are all there to support. Will give us some more information about that as we go along. Okay, a couple of other people here who've got a question. Is that Amos, is it? Amos. Oh.
Hello, thank you so much, team. It's so pleasure having you here, and the presentation is so good. Actually, I was raising my hand to respond to the person who was asking a question about sampling, but you have handled it.
Okay.
So I have some
background. Amos, give us
yeah.
your thoughts as well on sampling, because it's always good to get thoughts from the participants as well.
Yeah, sure. Thank you so much. So I wanted to add on to what you said, that the sampling method that you select is mainly determined by the target population that you wanted to research on. So in some cases, maybe you want to do a research on a very rare condition or a very rare disease. In that case, you have to use a certain type of sampling that maybe does not require maybe randomization or something like that. So maybe to just give a wider categorization or grouping of sampling methods, we have the probabilistic ones and the non-probabilistic. The probabilistic ones are the ones that you are trying to have every member of the population have equal chances of being sampled into your sample. And the non-probabilistic ones are the type of sampling whereby you just target a specific population without actually or you target a certain group of the sample without actually having to have an entire representation of the population. So in a case whereby maybe you have a very rare mental health condition, you might end up using something like purposive sampling, whereby you just target specific people that you know may be having that condition, or people you have just heard that they have that condition, and or people who are stakeholders in that. And then you do a thorough interview to get information that will compensate the deficiency that will be brought in by your sampling method. So that's all I can say. Thank you so much for the presentation. It's really good. I don't have a background in mental health, but I have some background in statistics. I'm now doing biomathematics, my master's, and I've been doing some bit of research. So thank you so much.
Thank you. That's good. Just to say that although you do mention probabilistic and non-probabilistic methods there, if you're looking at statistical inference, it's usually only valid if you've got a probability that you can put on the person being part of your sample. So I think I'm very cautious about advising people to do non-probabilistic methods for sampling, but I agree that they are in use and they are useful for some of the mixed methods where the quantitative and the qualitative are there. Okay, I'm going to get Cesar to say what he wants to say, and then I'm going to go on to the next slide, which gives you a chance to think. Excuse me. Cesar.
Thank you so much for this presentation. It has been so informative. I'm Cesar from IDI, and I'm a data scientist by profession. I know that most of the algorithms we use behind them is mathematical modeling inclined on statistical means or methods. And I find that some challenges when people use symptoms of a disease to predict it than to use the risk factors. When do you use risk factors to predict a disease and symptoms? And how do you classify it? Is it a prediction of a disease or diagnostic of a disease? Because these are two things that I find around public health and people within the public health circles, which a bit confusing, and I find them a bit vague to me.
Yeah.
Thank you.
Thank you, Cesar. Yes, so I think this is where epidemiology differs from clinical research. I mean, as you say, clinical research is often using symptoms to diagnose disease, and I think that's a very important thing, but that's clinical research. That is not usually epidemiological. Epidemiology is usually about risk factors for disease, and symptoms might be used to define your disease, define your cases, define, your what you're looking at in the population, but it won't necessarily be. We wouldn't necessarily consider those as risk factors for the disease, because often symptoms are part of the disease that we're looking at, and so clinical research might be looking at symptoms and signs to define, diagnose our cases, their cases, but epidemiology is much more looking at risk factors, and I think this is where that sort of like research and epidemiological research. Okay, so here's some questions for you based upon sort of epidemiology. How would you define, and feel free to put your hands up, feel free to discuss this. How would you define some of these conditions on the right-hand side? What would you use to define the prevalence of depression in nurses or in any other group, or the incidence of anxiety amongst students in the final year? And these are sort of like different mental health conditions you could have here. Depression, anxiety, psychosis, trauma, etc. And what would then be the denominator, and how would you describe the sampling that you do from that population at risk in order to get your sample? Just think about some of these things. If anyone's got any comments that they want to make, I think that would be quite useful. Otherwise, yeah, I'll wait for a few minutes to get a few comments, and then we can go on to the next part of the lecture. This is 1/3 of what I've got. I'm going to go on to study design in a minute, and then to evaluation of impact. Yeah, so just looking at the questions and answers there. Practical training in sampling. We're not going to. I don't think this course is going to do a practical training in sampling. But there's a lot of good courses on YouTube and on some of the other free courses, which you can have a look at. There's also a lot of resources which go through that. I think that the team that we have here for this particular Mental Health Data Prize will be able to give some advice on it, but I don't think we're going to give a whole course on sampling or how to do sampling, because there's a lot there which is probably not really necessary for everybody in this group. But I think that somewhere along the line, there's a question here about do we need to, are we required to sample if we're using secondary data? I don't think it's necessary. I think you could use all of the data that you get, but there may be something that restricts your analysis to a particular sample, or you choose a sample in which you would actually do that. So quite often not necessary, which is why we're not going into sampling too much of a detail, but it may be necessary in some cases if you're going to collect some primary data. Okay. Okay. Yeah, okay. Right. Any comments then about how you'd measure your prevalence of depression? You know, do you have any tools that you're going to use that would be useful there? I mean, I mentioned in my presentation the PHQ-9 tool, which could be used for measuring depression in a group of people. Yeah, PHQ-9. And, you know, Henry says the BDI as well. Plenty of different ways you could measure that. And of course, you're going to get slightly different results in that, in those cases. Measuring anxiety, again, you might want to say, if you're looking at this over time, you might be wanting to see how many people come into the clinic consistent with anxiety. Of course, you might be able to use the GAD-7 or the EPDS as well. Yes, many different ways of doing that as well. And then in each case, in those first two cases, there's a very clear denominator. What you're looking at is the whole population of nurses in the first case. You're looking at the population of students who are in their final years of university in the second case. And in the third case, you might be looking at patients who are attending hospital and so therefore attending clinic and who have psychosis and they are being treated in that hospital. And then in that second case, you would want to look at the impact of the intervention, how many people have the clinic, have the symptoms, have the symptoms and signs of psychosis are considered to be psychotic at the beginning, and how many of them get better and are no longer psychotic at the end. And that would be the impact of the intervention on the patients that we're seeing there. Again, screening the nurses. Let's have a look at the chat here. Screening nursing students, you'd have the denominator, and then you might have a list of all of the nurses, and then you'd be able to you'd be able to apply the screening tool to those nurses during the course of that. Yes. Yeah. So someone's asking where they might get these tools. There's a lot of tools available. I think if you do a search for tools for depression, some of them, just a warning here, some of those tools have been validated for use in Africa. Some of those tools haven't been used in Africa, and so therefore they've not been validated. They've only been used in other continents. And so you have to be a little bit careful about which ones might be useful, because some of the questions might be very context specific. And so you'd need to make sure that you could have that. Right. Okay. What about any difficulties you might expect on this? I mean, the impact of climate change, you know, might be quite difficult, because how are you going to measure that climate change? It's not going to happen over a short period of time. It's going to happen over a long period of time. And you'd need to have some measures which span several years of your, in order to be able to that measurement of the impact of climate change on the prevalence of depression, anxiety, and psychosis. Yeah. Okay. So it's a question frame you're going to be using, whether you're going to be doing this, you know, in a very sort of concise period of time, like the final year at university. It wouldn't take you a long period of time to do that, because you could do that at least within the year, whereas others might take a lot longer to do that. And some of them, they might be quite rare, and so therefore you might not get very many cases there, and you would then have to continue to collect those cases over a longer period of time. Okay, I'm going to move on a bit. We're still going to have some more. You're going to have some more tasks for you to do in a minute. So what I'm going to do now is I'm going to do a little bit of a